So my project was over cleft lip and cleft palate. So what is cleft lip and cleft palate? So according to the CDC, cleft lip and palate is defined as a birth defect that occurs when a baby's lip or mouth do not form properly during pregnancy. Together, these birth defects commonly are called orthofacial defects, clefts. So during my research, I found out that there are different types of cleft lip and cleft palate. So the upper lip is found to be the most common affected place with cleft lip and palate. It is very rare for the bottom lip to be affected. Unilateral cleft lip occurs on one side of the lip. With an unilateral cleft lip, a gap appears under one nostril and the nose might slightly tilt or look lower than normal. So a bilateral cleft lip occurs on both sides of the lip. With a bilateral cleft lip, a deep split might extend from the lip into both nostrils, causing the nose to look broader and shorter than normal. A complete cleft involves the entire lip and the other part of the jawbone that holds the teeth, also known as the alveolar arch. An incomplete cleft involves part of the lip. However, it is rare for it to go from the lip to the nose and is considered more severe. And then this photo I have over here is just a showing example of the different types. The etiology. So etiology is known as what is the cause of the disease. In this case, cleft lip and palate is more of a birth defect rather than a disease. The cause of cleft lip and palate are not fully understood. However, there is some research being done by the CDC that shows that it can be caused by a combination of genes, any changes in their genes as they develop, and environment around the mother can cause this. Cleft lip and palate is something that is congenital because it can happen through the genes. It can also be acquired during pregnancy due to the mother's environment. So pathogenesis is the sequence of cellular tissue events from initial contact until it manifests. Cleft lip and palate is something that can form very early stages of growing in the uterus. A lot of this starts with genetics, and because of this, it can be where the start of the cleft lip and palate can begin. Certain syndromes can be the cause of it. So morphological changes, a lot of the cell changes happen within the DNA or RNA. Because of this is something that can be caused by genetic changes as the baby grows. However, there is an increased risk of this defect happening in mothers who have an increased age when pregnant, so about the age of 35 or above. There are also some statistics that say biological children of a parent who has a cleft have a 4 to 6% chance of also having clefts. Clinical manifestations, so these are like signs and symptoms. So difficulty with feeding, difficulty swallowing, with potential for liquids or foods to come out of nose, nasal, speaking voice, chronic ear infection. These are some common issues that come with it. So this is the incidence and prevalence slide. So for this, I chose photos, and I feel like they both give out good facts about incidence and prevalence of cleft lip and palate. But anyway, so for the incidence, it would be about 600 to 690 cases in the U.S. And for prevalence, the bottom one is prevalence, and for about cleft palate only is about 6.35, and the annual number is 2,651. And cleft lip or without cleft palate is about 10.63, and the annual number is 4,473. I feel like both of these show a good photo and a good picture of the incidence and prevalence. But I think it is time to go on to the next slide. Right, diagnosis. Cleft lip and cleft palate can be diagnosed through a few different things. Prenatal ultrasound prior to the child's birth, and physical examination of the mouth and nose. Clinical course. This can start during the gestation period, day 35 or so. This is when the frontal prominence of the craniofacial structure fused with the maxillary process. This makes the upper lip. This process is under complete control of many genes, and cleft lip and palate can happen when there is a disturbance in the creation. This can be an acute thing or chronic. This all depends on the type of cleft lip and how much the symptoms are affecting the child. So this is my works cited. This is the works cited for the pictures, and then this is links.